Today, we need to talk about the story of one single building, the new National Children's Hospital. Its journey, from this state-of-the-art dream to a political nightmare, really tells us pretty much everything we need to know about Ireland's entire health service. Let's just start with the price tag. 2.24 billion euros. That is the official cost. It's not only the most expensive infrastructure project in the history of the state, but it's very likely the most expensive hospital ever built, anywhere in the world. And yet, for all that money, for all that time, the one question that matters most has no answer. Why isn't it open?
Okay, so let's really dive into this mystery, because this isn't just some ordinary construction delay. This is about a complete and total breakdown in transparency.
Think about this for a second. The health minister has had to openly admit she has no idea when it will be finished. And why is that? Because the builders, a company called BAM, just haven't given her the final schedule. Now here's the crazy part. Without that date, the country's entire health budget for 2026 is basically just up in the air. A private company is effectively holding the national health strategy hostage.
Now, okay, there has been some progress. You might have heard about it. Early access was granted to one level last month, and brand new equipment is finally starting to arrive. But, and this is a huge but, even after the builders hand over the keys, the hospital still needs another 7 to 8 months of work just to get patient ready. So, even the good news just shows you how incredibly far away we still are. So let's just imagine for a moment that the building was finished tomorrow. Well, that's when the next massive challenge begins. Getting patients inside is going to be one of the most complex logistical operations this country has ever seen. I mean, the sheer scale of this task is just immense. The plan is to move every single patient from 3 different children's hospitals over just one weekend. And the planners, they're tracking everything: Dublin traffic patterns, school holidays. They're even scheduling around major rugby and soccer matches to make sure the roads are clear and that there are enough free ambulances. It's unbelievable. And that brings us to the crucial point. This isn't really about logistics or managing traffic. At its heart, this is a high-risk medical operation. A seamless move isn't just a nice goal to have. For some of the country's most vulnerable children, it is literally a matter of life and death. There is absolutely zero room for error.
But you can have the most perfect building in the world and a perfectly planned move, and it's all meaningless if you can't trust the people in charge. And that brings us to the organization that's supposed to run this hospital, Children's Health Ireland, or CHI. And this is the fundamental conflict at the heart of the whole project. On one hand, you have the promise, right? This incredible world-class facility. But on the other hand, you have the reality, an organization, CHI, that is right now facing a formal inquiry into how it's being run. The history here is, well, the source material uses the word fraught, and that's putting it mildly. CHI has been absolutely rocked by controversies, devastating delays for kids who need scoliosis surgery, and then these damning reports about unnecessary hip surgeries being performed on children. Public trust has been completely shattered, and now this formal inquiry hangs over the very people who are supposed to be leading this incredible new chapter in healthcare.
So let's zoom out for a second, because the crisis at the Children's Hospital isn't happening in a vacuum. It's really just a symptom of a much bigger disease affecting the entire health service right now, the waiting lists.
Just look at this number. Over 600,000 people. That's how many are currently waiting just to see a specialist for the very first time. These people haven't even gotten a diagnosis or a treatment plan. They're just in a queue to get into the queue. And on top of that, you have another 107,000 people who are waiting for an actual operation. These are people living every day with pain, with uncertainty, with their lives completely on hold while the system just struggles to keep up. In fact, last year, the health service officially failed to meet its own targets for reducing these lists. All of this systemic failure has created what experts are calling a postcode regional lottery. What does that mean? It means your address, the county you happen to live in, could have a bigger say in how quickly you get treated than how sick you actually are. A brand new building can't fix an old problem like that. All of which leads us to the final, really critical piece of this puzzle. With these record delays and this crisis of delivery, where on earth is all the money going? So, the health service has a budget of over 27 billion euros for this year. By any measure, that is a colossal, staggering amount of money. And yet, despite that enormous budget, the financial pressure is so intense that health officials are literally being told to just stop something else, simply to fund basic things like a pay rise for staff. It just shows you the zero-sum game being played inside the health system. Even with billions, managers have to choose between paying their staff and funding patient services. And this is the vicious cycle that traps the whole system. There's a massive spend on incredibly expensive agency staff. Why? Because the approved full-time jobs just aren't being filled, and any attempt at reform just seems to stutter and stall. The result is that we are constantly paying more for short-term, inefficient fixes instead of investing in permanent, stable solutions. And that inefficiency is exactly what creates those postcode lotteries we were just talking about. You know, one of the best ways to picture this whole situation comes from an analogy in the source material. It says the Irish Health Service is like an airport trying to clear a massive flight backlog during a storm. They're building a fancy new terminal, that's the children's hospital, but they're still using old, broken runways, and they're relying on exhausted temp staff to keep the gates open. Which leaves all of us with this one final question. The problem here isn't just about one hospital, or one budget, or one waiting list. It's about a fundamental crisis of governance and delivery across the entire system. And you have to wonder, is the system itself now simply too big and too broken to fix?